If you are taking amlodipine, losartan, or lisinopril right now, stop everything and watch this. Because what most doctors never tell their patients, especially seniors, could be quietly making your condition worse. Not the medication itself, something far more dangerous. And by the time you finish this video, you'll understand your medication better than most people who have been taking it for years. This is not scare tactics. This is the truth your pharmacist doesn't have time to explain. Stay with me. This could literally save your life. Every single day, millions of seniors wake up, reach for their blood pressure pill, swallow it with a glass of water, and go on with their morning. They trust it. Their doctor prescribed it. Their pharmacist filled it. So it must be working. And in many cases, yes, it is working. But here's what almost nobody talks about. These three medications, amlodipine, losartan, and lisinopril, while genuinely life-saving, each one comes with a hidden layer of complexity. That hidden layer can either protect your heart or quietly put it under new pressure. And if you're over 60, the stakes are even higher, because aging changes how your body absorbs, processes, and responds to medication. What worked perfectly at 50 may behave very differently at 70. This is not your fault, but it is something you absolutely must know. Let me ask you something. When was the last time your doctor asked you specifically how you feel on your medication? Not just your blood pressure numbers, but how you sleep, how your legs feel, whether you've noticed swelling in your ankles. Whether you've had a dry, persistent cough, whether you've felt dizzy getting out of bed. If the answer is rarely or never, then what follows next is critically important for you. Let's talk about each medication one by one. Amlodipine is a calcium channel blocker. It works by relaxing the walls of your blood vessels, so your heart doesn't have to work as hard. It is one of the most prescribed medications in the world, but here is what many seniors don't realize. Amlodipine can cause significant ankle and leg swelling called peripheral edema. This can occur in up to 30% of patients, and this swelling is not dangerous on its own. But here's the problem: many seniors and even some doctors mistake this swelling for heart failure. They panic. They add another medication, or they stop the amlodipine without medical supervision. Both of those responses can be dangerous. There is also another concern almost no one mentions. Amlodipine can cause excessive gum tissue growth. This condition is called gingival hyperplasia. If your gums look puffier than usual since you started this medication, now you know why. Losartan belongs to a class called ARBs. It works by blocking a hormone called angiotensin II. Losartan is generally well tolerated, but there are hidden risks seniors must understand. Number 1, losartan raises potassium levels in your blood. This is called hyperkalemia. High potassium can cause muscle weakness, fatigue, and dangerous heart rhythm problems. If you eat a potassium-rich diet and take losartan, you need regular blood testing. Number 2, losartan can affect kidney function. In most people, this effect is protective, but in seniors with compromised kidneys, it can accelerate kidney decline. This is why routine blood work matters so much. Lisinopril is an ACE inhibitor. It is one of the most widely used heart medications in history. It is incredibly effective, but it carries one of the most misunderstood side effects in cardiology: the dry, persistent cough. Up to 20% of people on lisinopril develop this cough. Millions of seniors suffer through it without realizing the medication is the cause. They see specialists, they use inhalers, they are tested for asthma, all because no one connected the dots. If you have an unexplained cough and take lisinopril, that cough may be medication-related. There is also a rare but life-threatening reaction called angioedema. This is sudden swelling in the throat, lips, or face. It can happen even after years of safe use. If you experience sudden facial or throat swelling, seek emergency medical care immediately. None of this means these medications are bad. They save lives every single day. What matters is understanding how to use them safely. Informed patients get better outcomes every time. To understand why blood pressure matters so much, we need to understand what uncontrolled hypertension does inside the body. Your arteries are not rigid pipes. They are living, elastic, muscular structures. When blood pressure stays elevated for years, arterial walls thicken and stiffen. This is called arteriosclerosis. It affects the heart, it affects the kidneys, it affects the brain, it affects the eyes, it affects your energy and quality of life. This is why controlling blood pressure is not optional. It is one of the most powerful acts of self-preservation available. Amlodipine relaxes blood vessels by blocking calcium entry into smooth muscle cells. Losartan blocks the angiotensin II receptor. Lisinopril prevents the formation of angiotensin II. 3 different mechanisms, 3 different ways of controlling the same dangerous process. Understanding this helps explain why your doctor may choose one medication, or a combination of several. The biggest dangers for seniors are often not the medications themselves. They are the invisible combinations. If you take ibuprofen, naproxen, or aspirin regularly, pay attention. These medications can interfere with blood pressure control, they can strain the kidneys, they can increase health risks when combined improperly. Talk to your doctor about safer pain management options. Many seniors take a diuretic alongside their blood pressure medication. This is often appropriate, but electrolyte balance must be monitored carefully. Blood work helps ensure those levels remain safe. Grapefruit and grapefruit juice can interfere with how the body processes amlodipine. This can increase drug levels in the bloodstream. Blood pressure can drop too low. Dizziness and falls may occur. Avoid grapefruit if you take amlodipine. Blood pressure medications are not taken only when you feel like it. They work best when taken consistently. Skipping doses can cause unpredictable spikes. Never stop these medications without discussing it with your doctor. Think about your daily habits. Ask yourself if something in your routine may be working against your medication. For most people, the answer is yes. The good news is that medication works better when paired with healthy lifestyle habits. The right combination can mean lower doses and fewer side effects. Excess sodium reduces medication effectiveness. Many people consume far too much sodium. Hidden sodium often comes from processed foods. Read labels carefully. Choose lower sodium options whenever possible. Potassium helps support healthy blood pressure. Many healthy foods contain potassium, but people taking Losartan or Lisinopril should discuss potassium intake with their doctor. Balance matters. Poor sleep raises stress hormones. Higher stress hormones can raise blood pressure. Aim for 7 to 8 hours of sleep. Maintain a consistent sleep schedule. Avoid heavy meals before bedtime. Exercise remains one of the most powerful blood pressure reducers available. 30 minutes of walking can make a measurable difference. Consistency matters more than intensity. Walking counts, swimming counts. Cycling counts, chair exercises count too. Chronic stress contributes heavily to hypertension. Relaxation techniques can help lower blood pressure. Deep breathing can help. Meditation can help. Prayer can help. Time in nature can help. This is not soft medicine. This is physiology. Alcohol can raise blood pressure. It can also interfere with medication effectiveness. Be honest with your doctor about alcohol intake. Accurate information leads to better care. Research suggests bedtime dosing may benefit some patients. This approach is called chronotherapy. Ask your doctor whether it is appropriate for you. Accurate home blood pressure readings are essential. Sit quietly before measuring. Keep your arm at heart level. Take 2 readings. Average them. Avoid measuring immediately after stress, caffeine, or exercise. Accurate data leads to better treatment decisions. Many seniors have blood pressure that is high only in clinical settings. Anxiety is often the reason. At home, their blood pressure may be completely normal. This condition is called white coat hypertension. Your doctor needs both home and clinic readings. This helps create a more accurate picture. A 24-hour ambulatory blood pressure monitor is considered the gold standard. Ask your doctor whether it is appropriate for you. Some people think their blood pressure is normal because the medication has fixed the problem permanently. That is usually not true. The medication is keeping the numbers controlled. Stopping it may cause blood pressure to rise again. This is one of the most common misunderstandings in cardiovascular medicine. Seniors often tolerate side effects silently. They do not want to bother their doctor. They worry about being taken off a medication that seems to help. But side effects provide valuable information. They help your doctor make better decisions. Always report what you feel, even if it seems minor. If you are a senior taking blood pressure medication, here is your long-term protection strategy. Get your blood work done at least twice each year. Check kidney function regularly. Monitor electrolyte levels. Review your full metabolic panel. Monitor your blood pressure at home using a validated device. Check it at least 3 times per week. Review your complete medication list with your doctor every year. Look specifically for interactions. Ask about your kidney health. Chronic kidney disease and hypertension are closely connected. Each condition can worsen the other. Stay hydrated, but avoid overhydration. Ask your doctor about your ideal daily fluid intake. Maintain a healthy weight. Excess weight can significantly increase blood pressure. Never underestimate the power of awareness. You know your body better than anyone else. If something feels wrong, investigate it. Here is what I want you to remember. You are not powerless. Blood pressure medication is a tool, a powerful life-saving tool, but like any tool, its effectiveness depends on how you use it. It depends on how well you understand it. The seniors who thrive are not the ones who simply swallow a pill and hope for the best. They ask questions, they track their readings, they make healthy lifestyle choices, they work closely with their healthcare team. That is what I want for you. Not just controlled blood pressure, but genuine long-term cardiovascular health and a quality of life that reflects the vibrant senior years you deserve. The information you just received is what evidence-based medicine looks like. It is accessible, it is honest, it is genuinely useful. You now understand your medication at a deeper level than most people who have been taking it for years, and knowledge like this keeps seniors healthier. It keeps them safer. It helps them stay more in control of their well-being. If this video helped you, share it with someone you love who takes blood pressure medication. They deserve to know this too. Every day, millions of people take these medications without fully understanding how they work. Most never learn about the interactions. Most never learn about the warning signs. Most never learn about the lifestyle habits that can dramatically improve results. But now you do. That knowledge gives you an advantage. It gives you the ability to ask better questions. It gives you the ability to recognize problems early. It gives you the ability to work with your healthcare team more effectively. Remember that medications are only one part of the equation. Nutrition matters, sleep matters, exercise matters, stress management matters, regular medical monitoring matters. When all of these pieces work together, outcomes improve significantly. That is the goal. Not simply surviving, but thriving. Protecting your heart is really about protecting your future. It is about maintaining your independence. It is about preserving your energy. It is about reducing your risk of stroke. It is about reducing your risk of kidney disease. It is about protecting your brain. It is about protecting your quality of life. The choices you make today influence the health you experience tomorrow. Small decisions repeated consistently create powerful long-term results. One healthy meal matters. One walk matters. One good night of sleep matters. One blood pressure reading matters. One conversation with your doctor matters. These actions may seem small, but over months and years, they add up. They shape your health trajectory. They determine how well your body ages. They influence how much vitality you maintain later in life. Never underestimate the power of consistency. Consistency beats intensity almost every time. A simple routine followed for years is often more powerful than a perfect plan followed for only a few days. Stay informed, stay engaged, stay curious about your health. Continue learning. Continue asking questions. Continue advocating for yourself. You deserve healthcare that is informed, personalized, and proactive. And you deserve to understand every medication you put into your body. The more you understand, the better decisions you can make. Better decisions lead to better outcomes. Better outcomes lead to a better life. Never forget that your healthcare team works best when you are an active participant. Partnership creates results. Communication creates safety. Knowledge creates confidence. Confidence creates action, and action creates change. If you want more content like this, continue learning from trusted medical sources. Seek information that is evidence-based. Avoid fear-based health advice. Focus on facts. Focus on proven strategies. Focus on long-term health, because your future health is being built right now. One decision at a time, one habit at a time, one day at a time. Your health is shaped by the choices you make every day. Make them count.